Sarah, give us tips on how to answer our nursing school questions. Give us tips on how to answer NCLEX questions. Guess what? I brought axe. I brought axe. Ladies and gentlemen, as usual, see who is back. It is me again. It is Sarah Mustafa, for those of you that don't know. And for you guys, you guys are so supportive. You are so supportive. Thank you. Thank you. Thank you. I cannot thank all of you enough. So I am here to show my gratitude by saying thank you, everybody. I appreciate all of your subscription. To my new subscribers, I say welcome. We always say welcome every video. Trust me. Thank you, guys. Thank you. Thank you. I cannot thank you all enough. Thank you for all of your subscriptions. I really, from the bottom of my heart, appreciate it. So with that being said, let's jump right into this video. So, because as usual, you guys are so nice to me. You guys are always nice to me. So I brought some hacks for you guys. See, you don't have to only be practicing for NCLEX. These tips, short story. The other day, I met up with one of my instructors from school, and we were talking, and now she was like, "Oh my God, Sarah, you graduated," and blah 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 blah. We were talking about when I was in school, and all the challenges that we went through school and everything. And while she was telling me, I kind of like ask questions. See, I have mastered how to ask questions, how to be able to find answers, loopholes for you guys. I'll do anything for y'all. Anything. Ask me, apart from killing and going to jail. Anything, every other thing that I have to do with NCLEX. See, let's be helping each other here. Don't be thinking about any other thing. Illegal stuff, we don't do it here, okay? But when it comes to helping each other pass NCLEX and helping each other pass nursing school exams, that's what we are here for, and that is why you guys subscribed. So because of that, I will do everything in my power. Say, in this year, I will do everything in my power to make sure that all of you that are following me, you come back with testimonies. Okay, so let's get right into it. So as I was talking to her, I asked her randomly. I was like, so all those questions that you guys ask in school and everything, what are the best ways that you think we could have gone about it? And behold, everybody, she gave me tips and hacks. See, all of you, I will do a lot for y'all. I will see. When she was telling me, I was like, can I write it down? Can I share it on my YouTube channel? She was like, yeah, you can share it. Because she's my pathopharmacology instructor, and she also tutor for NCLEX. So I know she cannot tell me, oh Sarah, this is what you should expect, that's what they should expect. But she told me that I have some information, I have some ideas that if I give to them and they make use of it, it will help them. Even my mentees, this is the first time they are hearing this, because usually when I get information like this, they get it first because I call them. I tell them, I'm like, guys, I have another thing for you. Because trust me, you need someone to help you through nursing school. And behold, hi, I am here to help you. You need someone to help you pass NCLEX. And me, I have volunteered myself. Even though you don't want to take me, you don't have a choice, because as you close your eyes like this, it's me. As you open your eyes, it's me. You are sitting, it's me. You are eating, it's me. So get used to it, okay? So because of that, I have brought you hacks to be able to pass nursing school exams and to be able to pass NCLEX. I brought you hacks. The number one thing that she told me to tell you guys is that always remember that nursing questions, be it your school question, be it NCLEX, nursing questions are all about safety, patient safety, and common sense. For all of you, I know some of you would have you would have chosen some answers in your exams, and you're like, wait, why is it that? And let me give you a quick story. I remember when I was in school, there was this particular question that they gave us. I think it was introduction to nursing. I will never forget, because that introduction to nursing showed me Pepe. That class dealt with me. See, a lot of people get that class, like they pass with ease. I struggled through that class, so I know how hard it is. So I remember that there was this particular question that is, the question does, you walk in, the nurse walked into the patient's room. What should the patient do first? Assess patient, wash your hands, introduce yourself. Yes, it was that. It was assess the patient, wash your hands, and introduce yourself to the patient. Majority of us got that question wrong. Why? Because all of us chose introduce yourself to the patient. Yeah, I know all of you are wondering why it was wrong. Yes, because they expect that when you first get into the patient's room, the first thing that you do is to wash your hands. Let me tell you how we thought we were right. Let me tell you why. Let me tell you our own, because I chose it. So let me tell you the reason why I thought that question was right, that my answer was right, which is introduce yourself to the patient. You know that if all of you have walked into the hospital, or some of you, if you have a job, you know when you walk in, the first thing they will tell you is at least clean your hands with alcohol. So most of the alcohol are outside. So you, of course, get the alcohol. And when you go, you are doing this. Good afternoon, Miss Smith. How are you doing? That technically passed for you cleaning your hand. Okay, so when we saw that question, we didn't say, "Oh, wash your hands," because we're just like, "I already used alcohol." So another thing, assumption have killed you guys. Assumption, you are assuming. Don't ever assume anytime you see any question. We assumed that we already washed our hands, or we already used alcohol-based, hand sanitizers to clean our hands. So when we walk in, we are just talking to the patient. Meanwhile, your answer is wash your hands. I remember this question, see, when my friends and I were talking about it, it became so controversial, because we were like, no, this is wrong. Like, counsel, you cannot do that to us, because we all needed that extra point. My school did not give it, because they're like, well, the answer is always wash your hands. So you see that example, it was assumption. Don't ever assume. Patient safety is important. That's my second tips. Don't ever assume in nursing questions. Don't say, oh well, but as soon as you start saying but, it's already wrong. You're about to choose the wrong answer. So get it right. Do not ever and ever and ever assume in nursing questions. And remember, nursing questions is mostly about patient safety and common sense. So common sense, sometimes they always say is not common. So you follow me. Don't let us fight. You follow me, and because you follow me, you cannot be having no common sense. You need common sense, okay? Because you follow me, you need common sense. So tap into common sense. Stretch your hand forward. Oh yeah, pick it. Put in your brain common sense. That's it. That's how it goes. Don't bother. Don't try it. Anytime you are answering questions, you read the question and you read the answer, you are saying but it's wrong. don't do it. Another thing, another trick that she told me to tell you guys is that you put yourself in the position as the nurse. So when you see a question or when you read a question, when you're seeing answers like notify the provider, call RT, which is respiratory therapist, call the techs or call other nurses, it can never be right. Apart from them verifying another maybe like blood product. I think by now you guys know that two nurses have to verify blood product or blood related product or insulin. Apart from those, if you read any question and you have answers that say notify the provider, call the this, call the that, is usually the wrong answers. Why? Because you are the nurse. You have to do something. You, not any other person, not the provider, not the respiratory therapist, not the tech, not other nurses. You have to do something. You cannot call help. See, there's no help in this situation. No help. Is you and you alone. See it as your world. No other person is there to help. You are the only one in that world. You and your patient, not the family member, not the respiratory therapist, not the provider, not the techs, and not every other nurses, but you. So you have to do something. And remember, when you are doing something, it has to be patient safety. Whatever you're doing, patient safety is very essential. She also gave me this. I know you've heard a lot about this, but I just want to make sure that I grilled it in. Okay? I grilled it in your ears. Anytime you get answers that have to do with never, all, must, don't generalize, don't pick it. See, take time, okay? Don't give me blood pressure. Don't do it. Do not give me blood pressure. See, my blood pressure is nice, is doing fine. Don't come and give me hypertension. Don't pick any answer that generalized. All, never. See, never ever you ever always pick answer that says never, all, must. Don't do it. All those general terms, please, I beg you, don't pick it. Another advice that she said to notify you guys is that when you get options in your questions that they are opposite, you find opposite answers in your questions, one of them is right. So that means automatically you have 50-50% chance of passing. 50-50. See, if you're like someone like me, you always choose the wrong answer. There's nothing you can say. Nothing. You cannot tell me shit. If you're like me, you always choose the wrong answer. Just because for a reason. I don't like it. I'm not good at guessing. I'm worse when it comes to guessing. I'm not good at it. And because I'm not good at it, by the time I have 50-50% chance, I always get it wrong. So what helps me is I go back to read the question and I read the options again. I read the question and I read the options again. And I'm like, which one makes sense? And this gets me to another point. When you're answering your questions, okay, when you're answering any nursing school or NCLEX questions, but that another thing that they try to do is that they use the same term with different words. What do I mean by that? They can come up and say, especially, I think this is good for select all the apply questions, just because I remember this very well. When they will say, oh, the patient has increased blood pressure, hypertension. What's the difference? Isn't that the same thing? That's the same thing. So, majority of the time, when you read through your select all the apply, especially signs and symptoms, anytime you see headache, pick it. I'm telling you this. I think, I'm not sure who told me this or who gave me that. I'm not sure. I think it was one of my professors, or it was someone that I watched on YouTube. I really cannot remember. I don't think it's Mark Clemic, just because I know about this even before I graduated, because I started learning about Mark Clemic after I graduated. But someone told me that anytime in your select all the apply questions, the options, if you see headache, pick it. See, headache is for everything. Hypoglycemic headache, hyperglycemic headache, hyponatremic headache, hypernatremic headache, everything headache. Headache can change the level of consciousness. You cannot get it wrong. Never. You can never, ever get any of those options wrong. So if you're doing your select all the apply questions, if you see headache, pick it. If you see change the level of consciousness, pick it. You will get them right, and you will come back and thank me later. Okay? You will come back. Another tip for your select all the apply question. Let me tell you how I was able. I told you I have almost 45, I think 45 select or apply questions in my NCLEX. And I think the main reason why I passed NCLEX was because of my select or apply questions. Because I have mastered how to answer those questions. I think when I was in S1, there's something that I always do. Anytime I have select or apply questions, I read the question, and I most of my answers, I don't look at them until I'm done reading the question. And I made my own, I summarized the question in my own words. Because as soon as I do that, answers already jump up at me. I'm telling you, if you can do that, let's say they give you like a question and it's a select or apply. Read the question. Don't read the answers here. Just read the question and summarize it in your own words. What is the question asking you? What is the question telling you? Why do they have to give me this question? That's what I always tell myself. What am I looking for in this question? Most times it will tell you, and sometimes the first part that I read in my select or the apply question is the last sentence. Because the last sentence will tell you exactly what you're looking for. The reason why most of you get select or the apply question wrong is because you read the question, and by the time you get to the end, you already forgot what you read. You're already tired. So as soon as I see, and it's not just select or the apply question, I think you should also make use of this trick when you're answering any nursing question, including your NCLEX. Read the last sentence first, and then go back and read the questions, and then read the option. So select all the apply question. This is what I do. I cover my answers. Okay, I read the question, then I read one answer. Does it make sense? Is it true? Is this right? Then I treat it, I know every one of you would have heard, treat it like a true or false question. Is it true? By the time I read the question and I read the option, well, at least I read one option, and then I ask myself, does it make sense? Is it true? Is it false? If it's false, cancel it automatically. Read the question again, go back to another option, read that option. Is it true? Does it make sense? Is this right? Does it have to do with patient safety? Don't forget patient safety. Yes, it does. Then I'll go back. But I'm not going to say, oh, because I already find an answer, then that's it. No, I go through all the options. I mean, all. This is the only time I can generalize all the options. It is important. Some of you, okay, you read question, but you will not finish reading the question. And you're like, oh, I know. You don't know. And that's how you feel. And if you come back here and try that with me, me and you will fight. Don't let us fight. You see that me and you are smiling. We are good friends. Do not tell me, oh, because I already know the answer. I did not read it. Because that's why most of you feel. Because you did not finish reading the question. You already assume that you know what the answer, what the question is asking you without reading it. Some of you will say, that's why I'm telling you this, because it was something that I always do when I was in school, and I feel it because of that. Because the question will be asking me for best, especially those priority questions. The questions will be asking me for best, but me, I'll be choosing most answer. How does that work? How does that work? How does it correlate? What is this? See, when I was in school, I used to get frustrated with myself. Let me tell you why. Because I explain to people. Because the more I explain, the more I know. That if you haven't done that, then what is it? Try to explain at least one topic. And the good thing is, in my, I told you I had a group, and during my group, each of us pick a topic that we are going to explain to each other. So I love to teach. It is one of my thing. I love it. I love to teach. I love to see people grow. I love to see people succeed. But let me tell you, tell me how I'll be the one to explain stuff to people, and I'll be the one not to pass the class. Or I'll be the one not to pass the exam, because I never failed any class, but I'll be the one not to pass the exam. Why? Because I assume that I already know what the question is asking. So by the time I end up saying, okay, let me choose this or let me choose that, I'm like, oh, this is what the answer should be. But it's not. So please read all the questions. I know sometimes those questions can be longer. That's why I don't start from the beginning. I start from the last sentence, so that at least that will stick to my brain while I'm reading the rest. And with that, I'll be able to know what exactly I am looking for. So try the trick and come back and tell me how this helped you. Another thing that one of my professors that used to be in school told me about is that majority of the time, okay, when us students, when we go online and watch videos, and I told you that she tutors also for NCLEX, and she was telling me that most of our students will come back and say, but the YouTube video says that priority questions is one thing that you should, the first thing you do when you get in. And I told her, I was like, yeah, isn't that what it's supposed to be? Or isn't that what it is? She said, yes, that's what it is. But, when I have buts, I want to give you a trick about it. But what they actually meant by that is that you put yourself in the position of the nurse. Okay, when they say, oh, what is that one thing that you would do, and you would, because that sentence messed up with my brain, because I was like, okay, that one thing that I would do and I can go home. And sometimes I'll get the questions right, even when I use that. Most times I will get the question wrong. Why? Just because what they are actually explaining to you, or what they want you to understand about that, is that if you put yourself in the position of the nurse, and you put yourself in the position to be able to care for that person, not thinking I'm just a student. When you do that, what is that one thing that in your mind you're like, this is the only right thing? You put yourself in the position as a novice nurse that doesn't know anything, or is it that you put yourself as a position as someone that knows nothing. You're like, okay, I don't know anything. What I meant by put yourself in the position of someone that doesn't know anything, this will help you with priority questions. Now, let me give you an instance. You know that for stroke assessment, as soon as I said that, something should have jumped out at you. If you are really studying, something should have jumped out at you, which is be fast. For all of you, you guys know that they'll tell you, oh, you have to do this assessment that has to do with, okay, be fast, balance, and then is there a facial drooping, is there eyes, and so you guys know. Now if they tell you what is the best thing to do? The best thing for you to do is to do the assessment and then call 911. For instance, if they give you such a scenario and say, okay, you guys went for family reunion, and then you notice that all of a sudden, a patient has like a stroke symptoms. What is the best thing to do? And what is the most important thing to do? The best thing to do is to call 911. Okay? That's the best thing to do. To call 911 so they can take them to the hospital as quick as they can. The most important thing to do is to do your assessment. Let's say you're a student nurse. You do your assessment and you know the last known well. You already have that because those two informations will help in that patient's treatment. So you see what I mean by knowing the best thing and most important, your priority questions. You see how you can answer them. You see what you're looking for. Exactly. You are welcome. You, my dear, are very welcome. So another trick that she gave me that she said to notify you guys is that when after you have chosen your answer, okay, let's say you eventually choose an answer. The next thing that can help you to know if that answer is right or wrong is to determine the outcome. Determine the outcome. What's going to happen after I have chosen this answer? Now, I choose this answer. What is going to happen to my patient afterwards? Majority of the time, when you think about it like that, there are some options that you chose and you're like, it doesn't make sense. How can I choose this answer? Then the patient is going to die. Then what's the essence of choosing this answer? You see, it will help you to determine if you have chosen the right answer or not. So for those of you that have 50-50 chance, that has two options, you don't know which one is right, which one is wrong. You don't know you are choosing the wrong answer. That was one of my tricks when I was also in school. I kind of determine what I think will be the outcome of that answer that I've chosen. So if you are in a dilemma and you're like, okay, I have two options, I don't know which one to choose, use that trick. It will help you. I promise. You will come back and thank me. You will come back, all of you. You will come back and tell me. You will come back and give me the trick and be like, wow, Sarah, wow, this is what it is. Try it. Give it a try. So, with everything that I have said, let me warn you about one thing. See, if you don't want me and you to fight, okay, you don't want the both of us to fight. You like this friendship and the way I'm smiling every day. Please do not at any time in your nursing career, your school life, your NCLEX studying time, ever and ever second guess yourself. We do it a lot. I'm telling you all of this because they are the things that affect me when I was in school. Don't you ever, for one time, second guess yourself. Don't come back. And I think one good thing that my school did when I was in school was that you cannot go back to the previous question. Once you click on next, that's it. There's no going back because they realize that majority of the time, most students pick right answers, but you go back to go change the answer because you have seen one question that looks like that previous one. So you go back and go change that answer. No, there was a reason why you chose that answer. So let it go. Let it go. There's no going back to go back to select any. Take time. Don't give me hypertension. Okay? Because I want you to pass. I don't want you to come back and be like, damn, that was the answer that I chose at first. That was me when I was in school. That was me. See, all the time I told you, I don't like to have 50-50 option just because it takes me extra time to choose the right answer. Please do not at any point when you are answering questions second guess yourself. Do not. They intentionally put it there to confuse you. And the spirit of confusion, I take it off by God's grace. The spirit of confusion, I take it off. None. The spirit of second guessing, I will pray for you. I will keep praying. The spirit of second guessing, oh Lord, I take it off. I do. Don't don't let us fight. I'm praying for you every day, every time, because I want you to come back and be like, Sarah, it has been done. I passed my NCLEX. I passed my school exams. Please do not second guess yourself. I am praying for you, and I hope that all these tricks will be useful to you. Officially, we are going to start with the practice. Some people actually begged me to start with calculation questions because the schools are resuming very soon, and they know that they need this practice, the calculation. Like I said, in my school while I was there, you have to write it, and that if you don't pass it, then you won't be able to go on with the rest of the semester. So a lot of people are pleading to please start with that. So I'm going to start with calculation questions. If you know anybody that is struggling through calculation, tell them to come to me. Tell them to watch my videos. They will find it easy. It will be very easy. I will make sure that I explain to you why I think one is right, what exactly I'm looking for, and how I used to cancel sentences in my calculations. It's not so hard. I'm telling you, it's not so hard. It's not as hard as it seems. I think that's why schools want you to get a 90% or a 95%. I know some schools that you have to get the 98%, which is weird, but it's okay. That's their own rules. So who am I to say no? Okay, but who are you to go to the school to? Whatever. So we're gonna start with that, and because UWorld have updated their Q banks mid-January, we are getting UWorld. I think I checked it online. If you want to get it with the new generation one, I think it's about $500. If you want to get it for, I'm not sure how long, but I think it's about $500. I will get it, and then we are going to officially start practicing, because practice makes perfection. All this talking is enough. Let's get to work. Let's start practicing, because I've given you enough time. We are going to start our NCLEX reviews. I'm going to drop it twice a week. Please go in there and help yourself out. With that being said, we are going to start the practice soon. If there's any question that you have, please put it down in the comment section. If you have any question, for all of you that are saying thank you, thank you, thank you, thank me to thank you. That's thank you too. So thank you very much. I appreciate your subscription. I appreciate your words of encouragement. I appreciate you from the bottom of my heart. Thank you. Send this message to your friends. Send it to your students at school. I told my instructor, so she got my link to share, because she knows that I have tips. So she said she was going to share it as well in school, which was my previous school. So please and please and please share this information all around. Let people get to hear this information, because I think it will be a great idea for them if they can make use of the opportunity. So with that being said, it is a wrap. Thank you so much, everybody. I appreciate your subscription, your tuning in, your time, your energy. See, I said it this year. It's a year of our testimony. So I am praying for you every time. I am praying for you. That is all I have to say. As usual, tell a friend to tell a friend to tell another friend now. Come on. You can do this. Anyways, thank you guys. I appreciate it. See you in the next video. Bye-bye. Bye, y'all.